John Hammerly with the Plastic Surgery Channel, and I'm joined by my really good friend, Bill Adams, a great plastic surgeon, nationally, internationally known, based in Dallas. You, my friend, know all there is to know about this exciting news from the Aesthetic Society. We're talking about a Zoom boom as far as plastic surgery during the pandemic is concerned, but I think we should call it the Zoom kaboom, given these numbers.
Yeah, it's great to see you, John. This big number is $9 billion. It's reported by the Aesthetic Neural Network, which is a unique frictionless network that we've developed at the Aesthetic Society. This is actually the first year.
I'm going to interrupt you right there. 9, not million.
Billion.
Billion.
Yeah. $9 billion. And the Aesthetic Neural Network is an automated data collection system. So it automatically pulls from electronic medical records from surgeons all around the country. And, that's different than we've collected data previously. Previously, we had just had people reported in lists and then they would send it in. So I think this is even more. Yeah, this is even more accurate. And, certainly Zoom and these online meetings probably have had something to contribute to that. But it also is probably other things as well. Number one, people aren't going on vacation, so they have more expendable income. They're thinking they have time to recover if they're doing something that has a recovery. So all those things add up to, plastic surgery and aesthetic surgery has been really booming for the past year.
Are you surprised? I know a lot of your colleagues, maybe a year-ish ago, were saying, man, I'm a little worried, everything's shutting down, but lo and behold, given, maybe a month's shutdown, once they came back, you guys were busier than ever.
Yes, exactly. Yeah, I think a lot of people were concerned. Obviously, anytime you shut down businesses and people's practices, which never has happened to any of us, and since we got into this, it was a little bit weird. So it always caused for concern. But yeah, I think, once we learned what we were dealing with and we realized that, shutting down probably wasn't going to make a significant difference, then people were getting back to work. And what they found was that the patients were really eager to get in and do, whether it's non-surgical things or surgical things, but they were really keen on getting these procedures done.
Perfect segue. What did the neural network show in terms of what people wanted to get done? It was both a good combination between surgical and non-surgical procedures?
Yeah, as always, Botox is always the number one non-surgical procedure, followed by fillers. So those are literally millions and millions a year. The surgical procedures really followed the same breakdown that we typically see. So it's usually either liposuction or breast augmentation that's the number one procedure. Liposuction happened to be the number one procedure this year. And then that was followed by breast augmentation revision, abdominoplasty, and then breast lifts or mastopexy.
Is there any indication from the numbers collected through this procedure that the trend is diminishing any, or are we still full speed ahead as far as procedures, both surgical and non-surgical?
At this point, there's no sign of slowdown. Again, this is a typical upswing of the spring, but I think I can tell you from my own practice that we're exceedingly busy, much more busy than we've been in a long time, if ever. And my colleagues and friends tell me the same thing. So I think that this boom in plastic surgery is going to continue for the foreseeable future.
Well, I'll let you get back to work. I really appreciate you taking time between cases to talk about this. It just came out. It's really important news. If you've got any other questions about plastic surgery, you know where to come. You're right here, theplasticsurgerychannel.com.